Howdy, how are y'all, as we say here in Starkville, Mississippi. Actually, that's not true. But nobody says howdy. We do say y'all. That is a thing that we do. So, howdy. It is March 2019. Welcome back to Hail State Debate. And it is time for us to address the March-April 2019 topic, which is resolved. The illegal use of drugs ought to be treated as a matter of public health, not of criminal justice. March is a time of year when we have a lot of big tournaments. It might be your national qualifier. You might have a state championship in April. You might be going to the TOC. You might be going to any number of big tournaments. So there's a lot to prepare for here. And this is a really broad topic with a lot of different angles that you can come at it from. As you may have noticed, it is just me again. Luke, unfortunately, is off in a lab somewhere with his STEM major friends, literally creating like countermeasures for bioterrorism. So that's kind of important. So we figured he could have another month off. Hopefully, we'll have him back next month. But as always, even if it is just me, if we have to just sort of muddle through, we want to be helpful if we can. So if you like it, maybe give us a like, maybe consider subscribing. If it's useful, maybe tell a friend. As always, sources and timestamps are going to be in the description below. And if you like, maybe you could check us out on Twitter at Hail State Debate, where we do occasional updates, just things that we might not have had in the video. If we get a new idea, a new source, a new thought, either about the resolution or about debate generally, we will put it there. Lastly, if you have a question, please drop it in the comments under the video. We do try to respond to them. It's also kind of a good thing to just sort of generally read if you get the opportunity. So do that. And with that, let's move on and talk about the topic itself. My general thought is I like it a lot. I like it from an educational perspective because I think it's an important subject to address. It's an ongoing discourse. It's a subject that has been brought up in debate resolutions before, but it's kind of evergreen in the sense that it continues to be relevant. From a topic framing perspective, I might have a few nitpicks here and there. I might have limited it to the United States just to narrow it a little bit because there is so much diverse ground here. I know some people are concerned about it not specifying an actor. I actually don't have a problem with that. I'm totally fine with it as a matter of like LD and value debate, but I know some people would prefer to do it a different way. I also know that the term public health is a little vague. I mean, public health can mean a lot of different things. As you've been researching it, you may have had a little trouble nailing down exactly what a public health approach would do. It's kind of like social justice, and in the sense that most people like the idea of social justice, but what does it even mean, right? I mean, what does it include? What does it exclude? And that vagueness is important, and we're going to talk about that later. Both from the affirmative perspective of trying to narrow it down and the negative perspective of maybe exploiting that vagueness as a negative argument. But overall, I can't give it any worse than an A-. I think it's a great topic. It gives people a lot of different ground at a time of year when you want that. This is a very competitive time of year, and we don't want to see the same case over and over and over again. And when you talk about the diversity of arguments that you can make on this resolution, I mean, on the one hand, you've got arguments that are very philosophical, they're very value-oriented, things like moral culpability and what we would call in the criminal justice system the mens rea, the guilty mind requirement. If someone's addicted to a drug, is chemically addicted to it, can we even say that they have the level of culpability of bad decision making, right? Voluntary decision making, to hold them responsible for committing a crime? There's a great body of literature out there asking whether or not people who are addicted, and most drug users or many drug users are chemically addicted, whether they can even fairly be held responsible. There's also, on the philosophical front, the non-utilitarian front, there's also John Stuart Mill's harm principle. This is the basic idea that, look, if you're doing something that's bad for yourself, maybe it's just sort of generally considered bad by society, but it's not directly harming someone else. And in most cases, drug use, as opposed to drug, sales or distribution, drug use is not directly harming anybody else. Well, if that's the case, a harm principle advocate would say, what business does society have telling you can't do it? And certainly what business do they have criminalizing it and sending you to jail? On the utilitarian front, the AF has plenty of arguments based on empirical evidence about the ineffectiveness of the criminal justice system and the relative effectiveness of public health. There's tons of data out there. There are critical angles. Obviously, there's a massive body of evidence that talks about the disparities in the criminal justice system due to drug use being applied unfairly against communities of color and marginalized communities. And of course, there's a global angle. You can go outside the United States, you can go outside developed countries and be creative there. So it might at first seem that this is a really heavy topic, and I do think that overall, if you were just to run it straight up and just run the utilitarian argument, yeah, it probably would skew AF. But the negative has some advantages too. The biggest one is the fact that the affirmative has to defend two things simultaneously, right? The affirmative has to show you, number one, that we ought to be decriminalizing this drug use, right? And there are problems with that. There are arguments against that. And also that even if we do that, the approach you should take is not just decriminalizing it, but decriminalize it and then take the specific approach of public health. And so the negative can attack on both grounds, right? And that gives it a little bit more agility and flexibility, whereas the affirmative is kind of stuck in one place defending a very specific approach, right? The neg also does have some empirical arguments. We'll talk later about how there are empirical evidence-based arguments that maybe public health isn't so effective. Just consider, for example, the question of opioid abuse, right? For the last 10 years in America, we've treated prescription opioids mainly as a public health matter. And we've treated, for example, like heroin, which is also a form of opioid, mainly as a criminal justice matter, right? Well, which one has killed more people? The short answer is prescription opioids have killed more people than heroin over the last decade. So if this public health approach is so great, then why are more people dying from a drug that is mainly treated as a public health matter, right? So it's not like you don't have empirical arguments. There are also arguments about how criminalizing drugs helps keep them scarce and means that they're going to be less likely to be abused. So both sides have good ground. Both sides have some room for creativity. If one side has an advantage, the AF has a small one. But I think overall this is going to be a really well-balanced resolution. It's going to take work. You know, it's going to be different than some resolutions in that there are a diversity of arguments, and you're going to have to be prepared for those. But overall, it's really good. So the order for the video will be, number one, we'll do an overview of sort of the general framework of the topic, like how it works. Second, we'll talk about some definitions. Third, we'll talk about values and criteria. Then AF arguments, neg arguments, and finally, we will wrap up. Okay, so let's start with some sort of general framing of the resolution and the concepts in it, right? Because as we said earlier, this is a broad resolution with a lot of territory to cover. And so what we want to do is kind of pull back and have sort of a 30,000 foot perspective on it, just to get some ideas in your brain, make you aware of these general concepts that might come up, and maybe, you know, sort of learn a little bit about debate in general as we move along the way. So very broadly, I think you need to understand that this is a debate about the age-old question of deterrence versus rehabilitation, right? There's no question that drug abuse has a detrimental effect on individuals and society, right? It leads to lost lives, destroyed families, abused children, massive monetary costs, you name it. The question is, what are we going to do about it, right? And there's sort of two basic theories that like criminal justice experts and psychologists and other theorists have, among several, but two big ones that we're going to talk about. The first one is called deterrence theory, right? And deterrence theory generally says, look, if something is bad and harmful, let's try to solve it on the front end. If you want to make something less common, then you make it illegal, right? You impose a serious penalty, like a criminal penalty, that makes people reluctant to do it at all, right? The upside is you can potentially dramatically reduce the frequency with which something happens, right? So for example, if you want to make speeding less common, you don't try to sort of just encourage people and tell them speeding in your car could get you killed. It could be very harmful to you. Yes, we do that, right? But you also make it illegal to drive 100 miles an hour down the street, and it presumably reduces the instance of people driving 100 miles an hour if you send them to jail. So the upside is potentially reducing the frequency. The downside is that some people are going to do it anyway. And when they do, when they use drugs despite it being illegal, you're going to have to deal with them through a criminal justice system that is very expensive and inefficient, that's possibly biased, and that generally, at least in the United States and in many other countries, is pretty ineffective at rehabilitating them and getting them back into society after they've paid the penalty for what they've done. Another possible downside is you may discourage people. In fact, you probably will discourage people from seeking help voluntarily because they know that what they're doing is illegal and they don't want to seek help. Even if, you know, for example, a psychologist or someone else could promise, you know, not to reveal them to the police, people have less trust and are less likely to seek out help. So that's the basic trade-off with deterrence theory. Now, the rival to deterrence theory would be rehabilitation theory, right? Which is the idea that says, look, rather than criminalizing this, like rather than creating a prohibition on it, because we saw how well prohibition worked, right, for alcohol, right? Rather than prohibiting it, let's deal with the harms on the back end. Let's look at the damage that this does to people and society and help the drug user get back to a healthy lifestyle with an approach like a public health approach. It says, look, prohibition doesn't work. It didn't work for alcohol, right? It just created a massive black market with all the accompanying crime and violence. Let's skip that. Let's not do it. It doesn't work. Let's treat it like a medical problem and help get these people back on their feet, right? So the downside of that is, well, if we make public health a priority and decriminalize, right, drug use, which is what happens under this resolution. Remember that not all the evidence you're going to read, in fact, most of it is not going to focus on this strict dichotomy between public health and criminalization. You can do both, right? Most states have some measure of both. They have things like drug courts that lead to drug intervention and rehabilitation programs. So bear in mind that you're not going to have this strict dichotomy, but when you treat it like a strict dichotomy, either criminalization or public health, which is really what the resolution encourages, right? You're going to be removing most of your criminal deterrence. And when you remove your criminal deterrence, you can expect to see incidences go up. If you remove the speed limit, you can expect to see speeding go up, right? Now, if your public health interventions are really good, if you have a really robust system of public health in your country, maybe it doesn't matter, right? Maybe you achieve better outcomes despite having more drug use. But if they're not efficient and effective, and there's a strong argument that in the United States, and unfortunately in many countries, public health is not as robust as it needs to be. You may end up with a lot more drug use, a lot more crime, right? And no real effective way to deal with it. Now, as you can see, this all assumes a sort of consequentialist view of the issue. And that's not to say it's the only way to go. It's just that much of the literature does look at it in a sort of data-driven, empirical, how do we make society better? How do we lower costs? How do we save lives view? We're definitely going to talk about some of these philosophical things like the harm principle, like the idea of moral culpability later. But from a practical perspective, this is how a lot of the literature looks at it. So the next point is that the AF has two distinct burdens here. And this was something really important. That's why we mentioned it earlier, right? The AF has to do two things. It has to, A, win that public health is the desirable approach to addressing drug use, right? As opposed to something else like an individual choice theory or a learning theory. There are different theories that are not criminal justice, but are also not public health that the negative could look at as an alternative. And then number two, if the AF does that, they also have to prove that a criminal justice approach is generally or maybe even categorically bad and we should just not do it, right? And that dual burden is what I think balances what otherwise would be a somewhat imbalanced resolution. Because there is a lot of evidence that public health on balance overall is a somewhat more effective to illegal drug use than a purely criminal justice approach, right? But to be clear, right, most of the evidence that the affirmative is going to be reading comes from the real world where we don't have this strict dichotomy of either public health or criminal justice. It comes from societies where even if they're focusing mainly in some instance on public health, they still also have criminal penalties for drug use. So, pro tip for the negative, right? If the affirmative comes into the round and is reading all this great evidence about how wonderful the public health approach is in a given country and how it has achieved these great outcomes, one cross-examination question is, just to be clear, that study you cited is from a country where they do both a public health approach and they also leave in place criminal penalties for drug use, right? They do, for example, wherever in Denmark or whatever, right, still have criminal penalties for some drug use, right? And if they say yes, you say, okay, so this is great evidence, but it's not evidence for public health, not criminal justice, which is what the resolution requires. It's evidence for do both. And the negative would say, do both is my territory, right? I get to advocate for a situation where we do both some public health and some criminal justice. So just be aware of that. But just more broadly, using the phrase not criminal justice very explicitly like that, the resolution allows the neg to claim that the AF has the burden of excluding any criminal justice aspects entirely, or at least overwhelmingly, like largely, right? And that any hybrid approach is negative territory. Now, alternatively, if you want to go the other direction, you might accept that the criminal justice approach is bad, but argue that public health approaches are flawed. This is a little bit less common, but it might be a really sneaky, fun neg to run because, as we're going to talk about later, there are other theories, right? Like theories that deal more with education and rational choice and agency rather than treating it as a disease. And there are arguments about these. And frankly, an AF An app is probably going to be more prepared for you to attack criminal justice than they are for you to attack public health. And if you have an alternative to public health that is not criminal justice, I can see a lot of affirmatives being caught kind of unaware with that, right? So you might consider doing that, or you might do both. I could absolutely see a negative case in which you run both a criminal justice is bad and public health is bad. There's a better alternative. And if you agree with either of these contentions, I win, right? And this is why I think the neg sort of builds its way back up into a very competitive debate round, despite the literature swinging toward the affirmative, right? Next question is, who is the actor? And the short answer is there is no actor. And some people don't like this. I personally will tell you that I don't think there always has to be an actor. Lincoln Douglas is about values. I know it's easier and simpler to say X actor is going to do Y. It makes it very simple and straightforward. I realize some people want to debate that way. Honestly, I think it's actually good for you sometimes to not be able to do that. I think it's good for you to have to debate concepts. It will expand your mind. And the type of debate we do in college, we have to debate all kinds of different conceptual ideas, and it's good for you. And I know you don't want to do it. It's like eating your vegetables, but you need to do it, right? So one possible framing that's valid in context would be, even if there's not an actor, you could say, look, we would be better off as a society generally if we overall viewed drug use as a public health matter as opposed to a criminal justice matter. In other words, if society developed this sort of general viewpoint on things, right? And we're going to talk later in the values and criterion section about some ideas about like rural utilitarianism that sort of dovetail nicely with this, right? But the idea is, look, I cannot tell you, the neg comes in and says, well, what exactly is going to happen? What will the impacts be if we vote for you? And the answer is, look, in the real world, I can't tell you exactly what policies will be enacted, but I can show you good examples of how a public health approach results in better outcomes and works better and leads to healthier societies. And I can show you that if society adopts that general approach, we're more likely to have those good approaches and less likely to have your disastrous criminal justice approaches. And, if we're being real with each other, I can't tell you exactly how public health will play out. And you, Ned, can't tell me exactly how criminal justice will play out. And to pretend that we can is sort of a false precision. We're really being dishonest with each other and dishonest with the judge. So I just think we ought to adopt an approach that is somewhat more likely to lead to these good outcomes I'm describing and somewhat less likely to lead to the bad outcomes that you have. So at any rate, one other note on this point, I know we're covering a lot because this is a big topic. Be careful if you do try to specify a government actor, if you're in a circuit where you think you can do that, about just sort of blithely picking the United States, right? Because this resolution is not limited to the United States. And even if your circuit is one where they say, yeah, you can just sort of pick an actor and pick a policy and run a plan, some circuits are like that. You definitely open up yourself to a critique of sort of Western, sort of American chauvinism, right? Of being indifferent to the fact that the vast majority of people don't live in developed countries. And I can certainly see a negative argument that says, look, if you just sort of glibly, without a warrant, without a card, say we're going to run this about the United States, I can absolutely see a neg response that says that's problematic in and of itself. Right? You're leaving out the majority of people in the world that don't come from developed countries, that have fundamentally different issues when it comes to this, have different resources, have different public health systems. So be very careful with that, right? Next question, and I'm going to spend a little bit of time on this, okay? The next question is, how broad does the AF's advocacy have to be? And what I mean by that is, does the AF actually have to argue for just a total global adoption of a public health paradigm and rejection of a criminal justice one? Or can the AF run a more specific plan? And I'm going to spend a minute talking about some linguistic arguments about when plans are and aren't acceptable in Lincoln Douglas debate. And if you're in a circuit where you know for sure that your folks are going to be totally fine with plans, it doesn't matter what the resolution says, then you might even skip this. That's fine. But I think that this is a valid argument that you can use and carry with you like further on in debate about like when can we run plans in LD? And the answer that I believe, just to preview, is it depends on how the resolution is worded. Some resolutions logically admit of being affirmed by a plan and some don't, right? So we talked last month about how understanding linguistic concepts is important to assessing resolutions in debate. We talked about how bare plurals exist. These are plural phrases that don't have a qualifier like some, most, or all. And we talked about how to interpret them. And we said that there's an inherent ambiguity in what it means. For example, do you have to show that all military aid should end, or a majority, or maybe just one or two cases, right? And we talked about how there is a general principle that if a statement is a normative rulemaking statement, like in a statute or a debate resolution, that the natural language, logical way most people would interpret a bare plural is to treat it as a categorical all statement. So for example, if you said military aid should end as a general rule statement, the normal way to interpret that would be all, or at least the vast majority should end, not like one instance of it should end, right? Now, here we actually have a more clear, less ambiguous linguistic situation than the bare plural, because what we have is a noun phrase preceded by the definite article the. We have the illegal use of drugs, right? And this is the important part, so if you're skipping around, this is the part you want. While bare plurals are considered ambiguous, while there may be some room to determine how many of them you actually have to be talking about in the round, there's actually a strong consensus about what the definite article the followed by a noun phrase means in terms of how many, in terms of whether you can run a plan, right? Whether you can just pick one. And this slide comes to us from Angela Downing and Philip Locke in English Grammar, a University course, 1992. And if you look down into the first bullet point, it says, the represents the referent of a noun as a single undifferentiated whole class of entities. So, for example, when we say, the elephant never forgets, unless there's a clear context, right, that says the elephant means that particular elephant over there, or the elephant as opposed to the, gazelle that's next to it, right? Usually the followed by a noun phrase means the entire undifferentiated class, right? So to just give another example, when we say the lion is the king of the jungle, we refer to the entire class of lions. When we say the symphony is the grandest form of music, we're not talking about that particular symphony that you're listening to, we're talking about the idea of the symphony. The entire undifferentiated class, right? The use of biological weapons is a war crime. The general class of using biological weapons, right? Now, there are contextual situations where you could change this. For example, if a child had 5 specific toys and they say, which one do you want to play? And there's an elephant and a lion and other things, and then they say, I want the elephant. That's fine. In that context, it might refer to a specific one. But absent any specific context, the followed by a noun phrase generally refers to the entire class, which means, right, and thank you for staying with me, right, that there is a strong argument on this resolution that the affirmative should not be allowed to run specific cases or advocacies that are limited to a certain type of drugs or a certain type of use or certain specific situations, because the refers to the entire class of illegal use of drugs, right? Now, this conclusion is further strengthened by the fact that most definitions of public health talk in terms of very broad, holistic, societal level stuff, which we'll talk about in a minute. So specific plans are going to be a tough sell as a result of that. And so I think there is a linguistic argument. This isn't about debate theory. This isn't about like, are plans generally okay, right? Of course, there are some resolutions where plans are okay. It depends on the language of the plan, right? If the resolution is resolved, we should go eat pizza, and you run a case about Pizza Hut being a good place to eat, well, that clearly affirms it, right? Because that's a policy plan that asks, should we do a thing? And you can only do one version of that thing at a time, and you're describing one version of the thing. So as a matter of logic, it makes sense. So this is not an argument like under the rules of debate or the unspoken theory rules of debate. It's an argument about language. And the particular language of this resolution is the illegal use of drugs, which refers to an undifferentiated class. So I think there's a strong argument, and this may be unfortunate given how broad the resolution is, that you actually cannot validly affirm this resolution with a plan. Now, I get it. Some circuits are going to not care about that. They're going to say you can do it anyway. They're going to say it's only fair that you get to use a plan. This is too broad. But to be clear, what they're doing when they do that, they are not any longer following the language of the resolution to a logical question of whether it is actually proven true. They're just sort of circumventing it. They're overriding it. They're saying there are things that are more important than the language of the resolution, like fairness. I'm not a fan of that, but some people are going to do that. Anyway, we may talk about this more in a future video, but I wanted to spend some time on it talking about how I think that there is a linguistic argument that plans plans don't affirm here, and you may want to prepare for some thoughts on that if you are the neg, if you are in a circuit that runs plans and you think you can get judges to buy it. So those are some general framework questions. I know it took a good bit of time. We will next move on and talk about definitions and then values and criteria. Okay, so let's talk about some definitions. First of all, we're going to start with public health because I think this is the most vague term in the resolution. I think that public health is a little bit loaded in favor of the app as a term for a couple of reasons. First of all, because it's vague, and secondly, because it generally has a positive connotation, right? I mean, who's against public health? You don't see a lot of articles out there saying, you know, public health is trash, we need to do away with it, right? If you're the affirmative, actually, I would want to try to sort of narrow it down just a little bit if I could, maybe to the specific context of drug use, because it is so broad that it could potentially become unwieldy, right? So we have this definition here from Schrodel and Fiber, I think that's how you pronounce their names, from 2001 that calls it viewing drug addiction as a disease that is best treated as a medical and psychiatric condition, right? I like this definition because it's contextual, right? It's about drug use, drug abuse, right? Drug addiction, close enough though, right? It's about drugs specifically. So you can always say prefer this definition over sort of just generic definition of public health because it's talking about the specific subject matter of drug use, right? I also like it because it focuses on the general perspective we should take on drug use as opposed to any particular action. And that makes it easier for you to sort of argue that, look, what we're doing in this debate round is we're talking about what overall view society should take. Should it have a general paradigm of public health or a general paradigm of criminal justice, which I think is a very manageable way for the AF to run this. It avoids the complications of having to run plans. It does take a little bit of adjustment if you're a policy first kind of debater, but I think it's a way that I would consider doing it. Now, if you're the negative, you might want to try to be a little bit more tactical about this. You may not care. You may sort of just run a generic definition and just sort of concede it, and that's fine. Especially if you're focusing on criminal justice, right? Especially if you don't necessarily think that public health is bad, then maybe you don't need to worry so much about it. But one tactic that you could take as the negative is to argue that public health is such a vague term that the judge can't really know what they're buying. It's too vague to affirm, right? And so this Fezo 2004 definition talks about how public health is this evolving, moving target. It's constantly changed throughout history. Since 1990, it's referred to, quote, assisting individuals and communities by educational, economic, and political actions to increase control over and improve their health through attitudinal, behavioral, social, and environmental changes. Whatever that means, right? And the argument you can make to the judge is, look, you can't adopt that. You can't buy into that. It's just too vague. You don't know what you're getting. Educational, economic, and political actions could be anything. Attitudinal, behavioral, social, and environmental changes could be literally anything. And as we'll talk about later, you would say, as the negative, they don't always work, right? Trying a public health approach with opioids as opposed to criminalizing them, or at least rigorously enforcing the criminal prohibition, hasn't worked, right? And there's actually evidence that you can cite for people within the public health profession itself saying this term is too vague. We don't even know what it means. For example, this Virginia Barrage 2010 quote talks, about how there's this debate and this uncertainty and this frustration even within the field of public health about, like, what does it even mean? What are we referring to? What are we not referring to when we talk about public health, right? And I don't think this is something I would hang my whole case on, but as a quick 30-second thing to do in your definitions to say, look, this is too vague. You don't even know what you're getting. Judge, you're not going to go into a restaurant and order the food, right? You're not going to order the carbon-based nutrient supplement that reduces your hunger. That's too generic. You want to know, like, what kind of pizza am I getting? And if the app can't tell you something about what you're going to get from this beyond it's social and political and it has all kinds of ramifications, that sort of stuff, then you don't know what you're getting. You can't vote to affirm. Maybe you try it, maybe you don't. Maybe you don't want to worry too much about it. Either way is fine. The phrase "the illegal use of drugs" is next. Remember earlier we talked about what the definite article means. I won't go over that again. You might consider, if you want to take a hard line against plans, you might have something in your case where you're ready to read a card about how "the" means you have to affirm all and therefore plans don't work. Maybe you don't. That's completely up to you. Illegal use of drugs. We'll talk about that in a second. Notice the phrasing here is important though, right? It is illegal use of drugs as opposed to illegal drugs, right? Illegal drugs would be limited limited to things like cocaine, in many places marijuana, methamphetamines, things that are in them of themselves illegal. You can't possess them in any capacity, right? Illegal use expands it to include things that are generally legal to possess in some circumstances, but illegal to use in others. So, for example, we would be talking about, prescription opioid abuse, right? And so that is important. Opioid abuse is topical because if you don't have a prescription for them, it's illegal to use them, even though they themselves are not, it's not a felony thing. It's not a felony to actually possess them, right? Also remember that use would strongly imply that we're referring to the consumption of drugs as opposed to possession with intent to distribute, right? So you have drugs in your possession, you've got a lot of them. That seems to indicate you want to distribute them. In this case, though, we're not talking about that. You certainly, that ought to be illegal if drugs are illegal, but right, this is about the use. And there's actually a definition of the phrase illegal use of drugs in context together. Like we talk about how we like defining terms of art together as a phrase because it's better than using the individual words, right? In the United States Code, Title 42, Section 1221, Part D, and it's kind of circular. It just says the illegal use of drugs is the use of drugs that's illegal under the law. So it's not entirely helpful, but it is a definition that says the use of any, prohibited substance. And if you want, you can go list the prohibited substances. Hopefully you won't have to spend too much time in most rounds going over that. Now, there is one interesting thing here. There is a wrinkle on this that I think is more useful, though. And that comes from the Encyclopedia Britannica. And if you note here, it says that drug use is the use of drugs for psychotropic rather than medical purposes. That's great, perfectly fine. You can use that. What's more interesting to me is that lower down in the entry, it distinguishes drug use from drug abuse, right? The term drug abuse is normally applied to excessive and addictive use of drugs. And this is a potentially interesting distinction, right, that the negative might want to take. The neg might say, look, not all illegal drug use is abuse. Right? You don't necessarily create any particular social harm by, for example, smoking a little bit of marijuana in your home when you're not driving in a state where it remains illegal, right? I'm not advocating for that. I'm not telling you to do that, right? But don't tell your parents I said that. But, many people would say that's not a problem, right? And so later we're going to talk about how the negative might leverage that definition and say, look, drug use, if we distinguish it from drug abuse, really doesn't create much of a social problem at all, right? If we're just talking about the use that doesn't rise to the level of addiction, that doesn't rise to the level of causing people to abuse their children and commit crimes, that's abuse. Right? If we're talking about drug use, then as distinguished from abuse, then that by definition means it's not causing social problems. It's just casually using the drug. And even if you don't like it, even if it's not a good idea, right? It's not nearly enough for us to criminalize it, right? A few more quick definitions. Ought, as you may know, there's a standard argument that ought implies a moral obligation rather than a policy imperative. I don't know that it matters this much because in this particular resolution, because the way this usually comes into play is if it would be practically impossible to do something, we might still say that there's a moral obligation to do it even if it's hard, but I don't think that's the case here. It's clearly possible to decriminalize certain drugs, and it's clearly possible to apply a public health approach. So I don't think there's going to be a whole lot of fighting over ought. If there is, and you experience it, please correct me in the comments, and maybe I'll spend more time on ought in a future video. Last thing, and this one is probably going to be overlooked, but and this may be an hour and 20-minute video, but we got to cover this. Treated. I think treated is a deceptively important definition in this round because there's two different meanings of the word if you look at Webster's. One is to deal with or handle, right? Which implies taking some action. But the other, arguably more common meaning for it in just common conversation is to regard something as, right? Which implies taking a certain perspective, right? As opposed to taking a certain action. If I regard something as a public health matter, that doesn't mean I'm going out and engaging in public health activity. It means that's how I view it, right? So one thing the AF needs to consider is, am I advocating for a particular action or for a particular perspective? And if I'm the AF, I think I might like a definition of treated that talks about regarding as a general perspective, and then I just make the link about how if society views this in a particular way, it's more likely to act in a particular way. Again, to get around the complexity and the issues with running a plant. On the other hand, if you want to run a plant, if you feel confident at it, maybe you want to view treated as to actually deal with or handle. But the distinction between whether your advocacy as the app is going to deal with a specific, here's what we're going to do. We're going to legalize marijuana and we're going to give out clean syringes for other drugs. Fair enough. In that case, you probably want a definition of treated that is about dealing with or handling. If it's, society ought to change its overall viewpoint, and here's why that'll be good, you probably want to look at it as regard as, okay? Lastly, criminal justice. I think a sort of general definition like this one from US Legal will be just fine. I think all you're doing here is just making it clear that we're talking about proceeding in the criminal justice system. The only note I have on this is remember that criminal justice, right, taking something out of the criminal justice system does not necessarily mean that you legalize it or that you remove all penalties, right? So for example, you can decriminalize a drug and still have it be prohibited under law. It can still be illegal to possess. It's just not a crime. What that would mean is that police could still come and seize it from you, right? It would still be unlawful for you to possess it. It would just be a civil violation or a sort of a regulatory violation. But don't let the negative necessarily force you into arguing for complete legalization if that's not what you want to do. There are tactical reasons why that might be what you want to do, but they're not necessarily the same thing. Complete legalization is a form of decriminalization, but not all decriminalization, in other words, removing from the criminal justice system, requires complete legalization. So just be aware of that. So I know we have covered a lot here. We may have a long video, but it's a big topic. So next we will move on to values and criteria. All right, let's do some values and criteria. The first thing you need to do is make a basic choice between consequentialist and deontological approaches to the resolution. This is something we do in a lot of cases, right? Consequentialist being like utilitarianism. Are we going to be measuring lives saved, dollars saved, the actual impacts? And deontological approaches just being higher principles of human behavior, things that come before the impact. In other words, it's right to do because it's the right thing to do, right? It's a fundamental choice we make in all cases. And one of the really good things about this resolution, I think, is that you have some good options on both sides, right? So we'll start with the AF. If you're the AF, I think you can go, for example, with the generic value of morality being, principles of right and wrong conduct. This is usually a pretty inoffensive, good value for most resolutions, just because it's kind of hard to nitpick it. It's hard to really sort of say that there's a problem with it. It does fit nicely here with the ought language of the resolution and the implication that talks about a moral obligation. Now, for your criterion, you have a lot of options. You also have a lot of options for your value. I'm not saying you couldn't use justice or any number of other things. You absolutely could. But whatever you use, you have a lot of options for your criterion. You might, for example, look to a formulation of utilitarianism. If you watched this channel before, you know that I personally am a fan of rule utilitarianism over act utilitarianism. In other words, looking to whether a general rule maximizes societal utility, achieves the greatest good for the greatest number, as opposed to a specific act. And this is for a couple of reasons. It seems to be more in line with what a debate round asks us to do. A debate round doesn't ask us to go in a very specific circumstance or context with a lot of facts and choose what the right course of conduct is, like a choose your own adventure book. Rather, it asks us to pick a rule and decide whether it's a good rule or a bad rule for society. And so rule utilitarianism seems to fit a little bit better with that. And it also lets you dodge some of the stock criticisms of act utilitarianism. So if you do decide to go with rule utilitarianism, John Stuart Mill is sort of the classic option as a philosopher. You can certainly go with Mill. He's got some good stuff. But if you're looking for something a little more current, a little less predictable, there are good 20th century philosophers on rule utilitarianism like Richard Brandt. Now, Richard Brandt is not a guy I've talked about on this channel before, but he is someone I've talked about with my own debaters that I have coached. And I really like his formulation of rule utilitarianism. It's called the ideal moral code theory, right? And it's not really groundbreaking or anything, but it just sort of says, look, the right way to decide if a proposition is good or bad, appropriate or inappropriate, moral or immoral, is to ask, if we affirm this resolution, would it make our overall moral code for society more just or less just? Would it achieve better outcomes or worse outcomes? In other words, we're constantly building this sort of ideal moral code that includes things like don't kill people, don't discriminate on the basis of race, right? And so the question is, if we add this principle in this resolution to that, not law, but sort of informal moral code, would it make people better off? And I think this is a really good way to formulate most debate resolutions, and in particular on a case where we're sort of being asked how we should view a problem, what overall general approach we should take. So I like Richard Brandt a lot. I think he's somebody you might want to put in your back pocket for multiple resolutions, and I think he's a good fit here. Now, from this, you can jump off and argue anything you want. You can argue lives, cost, the ineffectiveness. You can argue biased enforcement. You can argue pretty much any disadvantage you want as the AF, right? The only downside is real utilitarianism is a little predictable. Most people will be running some variant of a utilitarian argument, even if they don't really explain it on this topic. So you have to be ready for that. But there are other options. If you don't want to go straight utilitarianism, there are things that are more sort of principle-based, more deontological, like John Stuart Mill's harm principle, right? And so we're going to Mill again. Mill is, a prolific philosopher. He tells us that the only purpose for which a state's power can be rightfully exercised over any member of a civilized community against his will or her will, gender paraphrase, important here, is to prevent harm to others. In other words, the only reason we can use force against you, like the criminal justice system, is to keep you from harming other people. Right? And the argument is simple. Drug use in and of itself generally doesn't harm other people, right? Now, it clearly has secondary effects. It can cause you to behave in a bad manner that will harm other people, right? And we can criminalize those behaviors. If you go out in a drug-induced, state and commit a crime, we can criminalize whatever you did to harm people. But the drug use in and of itself is not particularly harmful in most instances. In fact, what we could say is that most of the harm that comes about as a result of drug use is a result of us criminalizing it. Cartels and gangs and violence associated with drug use is mainly from us having criminalized it, and we'd be doing away with that harm by decriminalizing it, right? So this is, I think, a very sort of good fit, nicely tailored fit for the resolution. You do have to have some evidence about why, we shouldn't criminalize drug use to stop the secondary harms. In other words, the secondary harms of people behaving badly when they're on drugs. You have to be able to defend that we should criminalize those things, or at least try to stop those things, but not the drug use itself. But otherwise, I think it's pretty good. And then a third possibility for the AF is the idea of the lack of mental criminal culpability, what we call in the criminal justice system the mens rea requirement, the guilty mind requirement, right? And there's plenty of writing out there in legal journals and also in just sort of general philosophy about the idea that to punish someone criminally for a serious crime in the American criminal justice system and in virtually every developed country, you have to show that they had a mens rea, a guilty mind, a culpable intent. And if you don't, you can't punish them. This is why if a person commits murder and they say that they were temporarily insane, it's very difficult to show that. But if they can show that they did not understand what they were doing and didn't have control over their actions, they go free, right? They are exculpated. They are acquitted of the crime. So you have to have a guilty mind. And the argument would be, if you are chemically addicted to drugs, right, which many, many users are, particularly the ones that have the most problem or the most likely to end up being arrested, then you really can't say that you have a culpable state of mind when you're doing this. You might have long ago when you started, but now, years later, you don't really. And is it fair to punish you for that? And so that's another possibility. Now, if you're on the negative, I would say that you can absolutely run a morality value and a rule utilitarianism framework. And in fact, I think it's probably your best shot. Right. There are strong utilitarian arguments on the negative about how, number one, completely removing criminal justice from the equation would be a very suboptimal idea. It would make drugs much more common, much more easy to get. Even if you don't like criminal justice the way it's currently run, it still needs to be part of the equation, because if it weren't, the problem would get a lot worse. And then also, public health as a paradigm is not the ideal paradigm. So under a utilitarian framing of that, you should look to to other options that would achieve better results, right? And this just goes to the fact that as the negative, you need to be very careful about how you're framing the alternative to what the app is proposing. If you go in there and say, yeah, I think that the status quo of how criminal justice handles drug use is fantastic. I think it's great and we should keep doing it. You're going to have a hard time. I think most negatives are going to have to frame the resolution in a way that looks to another alternative where you say, look, I agree the status quo is not great, but what you're trying to do of getting rid of criminal justice entirely, that's not the right thing. Or what you're trying to do by using public health as opposed to a different paradigm, like an educational paradigm or something like that, that's not ideal either. In other words, when you do the utilitarian calculus as the negative, you're not comparing whatever the app is proposing to the status quo, you're comparing it to some other alternative that you as the negative get to propose, right? And I think that's important. Another option, last thing for the negative, would be this sort of standard criterion of the sort of categorical imperative with Kant, and the idea being that you don't meet the categorical imperative F, right? We've talked about this in prior videos, but it basically runs like this. The categorical imperative from Immanuel Kant and from others who formulated it requires that for an action to be moral, it has to be generalizable into a universal maxim. So basically the question is, can we make this resolution into our universal maxim? And the basic answer is no, because there are many exceptions in many cases where criminal justice does need to play a role, even if not in the current way that it does, even if not in every case. There are cases where having a criminal justice component can be helpful. And then there are also differences between how countries might handle it, and differences in how public health approaches might work. And public health might only work in some instances and not in others. And you basically say, look, I don't have to show you that it would be bad for us to do public health in every case. What the affirmative has to show you is that this is a universal maxim that we ought to apply to basically all instances of drug use. And if I can show you that there are massive exceptions, that we should make the call on a case-by-case basis, right, then I should win as the negative. So lots of good options in terms of how to frame the resolution, and that's what a good resolution lets you do. That's what makes LD debate fun, is having different approaches. So now, after all of that, at long last, let's move on and talk about the substantive arguments on the affirmative and then later on the negative. Okay, so let's get started with some affirmative arguments. And I think the logical place to start for the AF really is the basic utilitarian arguments against the use of criminal justice as a paradigm and in favor of the use of public health. There are so many practical, statistics-based, evidence-based, utilitarian arguments about why the current criminal justice system is bad that there is no way we could cover all of them or even most of them in any depth. So what I think we will do instead, because there is so much good literature out there, is we'll do a quick brainstorm that kind of lays out a lot of the different permutations of the argument, right? Some of the more basic ones like costs and lost lives, but also then some of the more kind of esoteric ones. And what we'll do is in the notes down below, we're going to drop some really good basic summary articles. There's one from Human Rights Watch in 2016, one from the Drug Policy Alliance in 2017, and one from the Center for American Progress in 2018, as well as some others that lay out just a great sort of panoply of statistics and thoughts on this, and they give you sort of links and jumping off points if you want to do further research. But this is one on which you're definitely going to have to do your own research, but it won't be hard, right? Because there's just so much material out there. So just to kind of brainstorm the basic harms of the criminal justice approach, first of all, I mean, we could start with the overall cost to society, and I mean in terms of financial cost. Just the sheer number of arrests we're talking about, the cost of policing. The Center for American Progress estimates that the war on drugs overall has cost the U.S. a net $1 trillion. That's $1,000 billion, $1 million that we wouldn't have otherwise spent since the 1970s, and that legalizing marijuana alone would save us $7.7 billion in enforcement costs. So the cost angle is one that's good. Of course, you have to factor in the cost of public health as well, but the net $1 trillion is a good statistic to use. More important, though, than financial cost is saving lives. So, for example, Center for American Progress also looks at how some of these state and local programs that go out and treat drug use as a public health problem are actually demonstrably saving lives. So they, for example, look at a Massachusetts program where first responders treat opioid overdoses with naloxone, I think is how you say it. It says it results in an 11% reduction in deaths. Needle exchange programs in Washington state result in a 70% drop in new HIV infections and things along those lines, right? So you can find plenty of statistics about how the criminal justice system is, not treating people, not actually treating the problem, not getting them in to get help, maybe even discouraging them from getting help because of the criminal penalty. And so saving lives is another one. The third area, though, and one in which you've got a lot of different separate impacts, right, is just the massive human cost of applying the criminal justice system and paradigm to drug use, right? Just how it destroys people's lives. And the basic argument here is that criminalizing drug use, as opposed to, say, drug distribution, right, which is a different thing, but criminalizing drug use serves as this massive on-ramp, right? This huge exit onto, or off of, whatever you want to say, this huge on-ramp onto the highway of the criminal justice system. And it's a system that's biased, unfair, coercive, and generally life-destroying, right? And so you can use a lot of these arguments about how all the unfairness of and all the inequitable nature of the criminal justice system, the way you get into that is through, for many people, the criminal justice process for drug use. So, statistics show us that about 75,000 people are in jail at any given time purely for drug use, as opposed to other drug offenses like distribution. There are hundreds of thousands, 450 or 500,000 who are in jail for other drug-related offenses. But remember, in this resolution, we're just talking about use. And then you get into all the problems that come with that. So we start with racial disparities, with African Americans being about 10 times more likely to go to jail for drug possession. There's famously the ways in which law enforcement have, for example, penalized and prosecuted powdered cocaine possession, which is more common among white folks, as opposed to crack cocaine possession, which is more common among African Americans, is the subject of countless examples of discussion. There's also the potential for arbitrary search and seizure. Since a lot of people occasionally use things like marijuana, this gives the police the pretext to stop just about anybody. And there are articles and testimonials about how the phrase, "I smelled marijuana," from a police officer stopping a car, wanting to harass or wanting to search the car, that's a statement that really can't be verified. It can't be falsified. It's often used, many people feel, as a pretext, right? And so in essence, the argument is that the criminalization of this thing that many people have at some point in their life basically gives law enforcement who want to behave in a racially biased way sort of carte blanche to do that. You can stop not almost anybody, but a lot of people. And if you choose to do that, you can use it to, for example, a suburban police department might use stopping people and saying they smell marijuana as a way to sort of harass folks that they don't want to be in their town. There's many other things. Coercive prosecution. You get people in, there might not be evidence to send them to jail. We use plea bargaining, which I think has been a debate resolution in the past. 99.8% of all the drug convictions in New York between 2010 and 2015 were from plea deals. You basically assign a massive penalty to drug use, like 25 years in prison, and then you tell them if you don't plead to, say, 3 to 5 years, then you might go to jail for effectively, most of your life, right? So we're coercing people into these unfair deals. Criminal records prevent people from getting jobs in the future and thus perpetuate cycles of poverty. Even if you have a very minor criminal conviction, like you don't go to jail, a lot of times court costs and fees will be assessed against you in the hundreds or thousands of dollars. People can't pay these things, and as a result, it shows up on their credit. It prevents them from getting loans. It affects their credit score, things along those lines. Drug convictions can result in revocations of driver's licenses in many states. That can lead you to lose your job. It can lead you to have difficulty with childcare. For lawful immigrants, documented immigrants, you can see deportation for a simple drug offense, even if you've never had any other criminal activity, changing the course of your life and your family's life. There's the impact on children and family members. I mean, the list goes on. A majority of women who are convicted of drug crimes and drug offenses have children, and many of them don't have any other parent present. And this has a major impact on those children's lives. In most states, your eligibility for welfare benefits like TANF, temporary aid for needy families, is at least partly linked to whether you have a drug conviction. There's a federal law that allows states to cut off your benefits if you have any drug conviction, and 36 states will cut off either all or some of your benefits as a result of a drug conviction, further exacerbating the spiral of poverty. And then finally, just on a totally incomplete list, there's disenfranchisement for felony convictions, right? So if you are convicted of a felony possession, even if it's not for distribution, right, you can lose the right to vote forever, which again disproportionately affects African Americans and people of color. So I guess what I'm saying is you have this criminal justice system that is unfair and makes life extremely difficult and perpetuates cycles of poverty for so many people in so many ways. And it's not unique to just drug use, but drug use is the massive on-ramp that allows it. So hopefully from that just very brief overview, you can see we've got a lot of different ways that you can argue from a utilitarian perspective that the current approach is broken and it's causing a net harm to society. So if you want to turn away from the purely utilitarian approach, like we talked about earlier, one good option that you can do, either it's its own separate standalone case or as part of a case linked to utility, is the idea of the lack of culpability, right? The lack of what's called the mens rea, the guilty mind requirement. And we talked a little bit earlier about how to frame this, but the basic argument runs pretty straightforward, which is that in criminal law and in sort of moral theory in general, right, we don't believe it's appropriate to punish someone who lacks the mental state necessary to know and intend to commit a wrong, especially a crime, right? That's why mens rea is literally written into criminal statutes. It's literally written into the case law of every state in the country and the vast majority of countries in the world, because we don't want to punish people who weren't in control of their actions, right? And so what that means is that in this case, you're going to have to spend time showing the judge that for at least, first of all, number one, that drug addiction, right, comprises a large percentage of folks who are actually put away on drug crimes. In other words, when we criminalize drug use, in many, many cases, we're dealing with folks who are chemically addicted to drugs. And fortunately, there is evidence that addiction plays a major role in those cases, and we'll drop some of it in the notes. But the first thing you'd have to do to make this argument is to have some evidence that addiction is a major factor, that the people who are being arrested and prosecuted are not just sort of casual users in most cases. They're not just people who decided to use it, but they're in fact folks who are chemically addicted to drugs. Once you establish that point, though, right, the argument becomes pretty straightforward. And kind of the seminal article on this, there's actually several articles from the same guy. His name is Alan Leshner. And from the late 90s to the early 2000s, he wrote a series of articles called various versions of Addiction is a Brain Disease, right? And in these articles, he gives this very fulsome explanation of how addiction fundamentally changes and rewires the chemistry of the brain. And it prevents a person from being able to make sort of truly volitional choices. In other words, once you're addicted to heroin, once you're addicted to cocaine, yes, in the sense that you have to get up and walk out and meet your dealer, you are making choices, but you're not really making a choice because you experience like chemical suffering, like receptors in your brain are altered such that you don't have any meaningful choice. In the same way that a person who's suffering from, any other form of insanity that commits a murder would have a defense, right? Because they wouldn't understand it. And so the argument would be, because you would have a defense to these other crimes, but in this country we don't have addiction as a defense, right? It's just not an option, and it's really not an option in most countries. That the paradigm of viewing drug use as a criminal justice violation is morally inappropriate on its face. Like, it's morally wrong on its face to punish a person who can't who can't make the decision volitionally. Right? Now, there are some objections to this, right? The first thing would be, number one, that at some point, you weren't, for most people, there are people who actually are subject to like drug exposure in utero and may be born with addiction, but that's pretty rare, right? For most people, you have to decide to go out and use the drug. And so at some point you did make a volitional choice, right? But it might have been years ago. It might have been under circumstances where you didn't fully understand what the harm would be. If you committed a wrong years ago under other laws, there might be a statute of limitations. So if the only thing you really did wrong, right, was to go and choose to use heroin 15 years ago, is it really appropriate today, when you no longer have a choice, you're a heroin addict, right, to throw you in jail? Regardless of whether it's effective, is it morally acceptable to punish you for something that you no longer have any control over? The second caveat I would have, though, is to be very careful with the evidence that you use on this particular argument. Because, for example, this evidence from Leshner, this addiction is a brain disease, it looks great. It has all this wonderful language about how addiction changes the chemical receptors in your brain. But if you actually read to the bottom of several of his articles, including the one that we're going to link to, He actually comes around and says, that the right approach to this is not necessarily to get rid of criminal justice involvement in its entirety. In other words, he talks about how a sort of hybrid system, right, of public health, but also some criminal intervention could be the right idea. So you're going to need to be very careful. On a gut level, though, if you can show that a large number of folks are addicted, and you can show that chemically, biologically, based on science, right, they do not have the ability to choose for themselves, this is a sort of a gut level position that a lot of judges, I think, will be sympathetic to. So that is another option on the AF. So lastly, for the AF, there are a few things I think you need to think about to prepare for, regardless of what kind of case you run. Whether you're running a purely utilitarian case about how public health works better, or you're running something more about mental states, or you're running maybe a truly libertarian case like we talked about earlier with the harm principle, saying, look, I'm not harming anybody. There's no reason for the criminal justice system to apply to me. Regardless of which ones you run, I think there are a few things you need to be mindful of and prepare for if you want to be effective. The first one is a very stock argument I think you're going to see from a lot of negatives, that decriminalization will drive up the use of drugs. Right? In other words, if you decriminalize something, you can expect to see more of it. And this is not just a specious argument. There is evidence for it. The Calkins 2014 evidence we're going to talk about in just a minute is summarized in a Box article, and it basically suggests that if you completely decriminalize drugs, you're going to see use go way, way up. I do think you need to prepare blocks for that kind of argument. Luckily, as you can see here, there is some good evidence from Portugal, which effectively decriminalized the vast majority of drugs a couple of decades ago. And the evidence seems to suggest that the use of drugs there not only hasn't gone up, but has gone down somewhat or stayed just about the same. So there is empirical evidence to suggest that this does not happen, right? The second thing you need to think about is what exactly you're advocating for. Are you advocating for just decriminalizing it, or are you advocating for like total legalization? Because those two things are different and they have a different trade-off, right? You may not necessarily be arguing for total legalization, which is effectively what Calkins is talking about, right? We could decriminalize the use of drugs, but we could still make it unlawful to possess them. It's just not a crime. We could make it a civil violation. Now, of course, you could totally legalize drugs. That could be what you advocate for in your case, right? And there are advantages. There are lots of cards out there that you can find about how ending the drug war entirely would save lots of lives. It would save huge amounts of money. The problem is you might open yourself up to the downside of, if we totally legalize it, right? If we totally remove any prohibitions, maybe it is more likely that use goes up because it's so much easier to get something if there is no penalty whatsoever. On the other hand, you can say we just decriminalize it, we leave in place the prohibition, maybe we still do interdict these drugs, we still do put drug dealers in jail, so maybe we still do see some of the violence associated with that because it's still not legal to buy, but in that case, the chance of seeing a massive increase in use might not be as great, right? So there are trade-offs and there are different ways you can advocate, and I guess the core message is know what you're advocating for. The second thing is be mindful that a lot of your evidence about the great benefits of public health is going to come from studies and situations where we were actually doing both, right? We were doing both a public health approach, but also in the background, especially in the United States and in most countries, there still was a criminal prohibition on drugs. So you have to be ready for the negative to question some of your evidence and say, well, look, that seems like a great outcome, but wasn't that in a country where we were really doing both at the same time? So it really doesn't help affirm your position, which is that we should get rid of criminal justice and only do public health. And so it would probably be a really bad idea to use things that are kind of a hybrid, right? Things like drug courts, pretrial diversion systems, rehab programs in prison. These are all bad ideas for the AF because even if they focus predominantly on public health, right, they still clearly have an element of criminal justice involved in them. I think a better approach for the AF is going to be to look at statistics where, like, maybe, for example, over time, like we didn't do public health at all, and then we adopted some public health program and the outcome got better. So for example, looking at the statistics from the Center for American Progress about how Washington State, implements a needle exchange program for clean needles and sees HIV rates go down. In that case, you clearly show that we have more public health emphasis, it leads to better outcomes, it improves health, and it saves lives, rather than something where you kind of have to concede that there is a criminal justice element to it. And then lastly, with plans, if you decide to run a plan, if you're in a circuit that allows running plans, I totally totally understand why you would on a topic this broad. You just need to be ready. You need to have blocks ready, because I think you're going to have people hitting back on the phrasing of the resolution with the unlawful use of drugs, right? The definite article "the," with the fact that public health generally refers to broad public perceptions, and the idea that treated can mean regarded as. So you just need to make sure that if you're going to run a plan, you are ready to potentially fight back on the idea that plans might not be valid in this case. And so with that, those are some options for the AF. Let's move on and talk a little bit about the negative. Okay, let's talk a little bit about the negative. Initially, I was a little concerned about the negative, but the more research I've done and the more work we've done looking at it, the more I think that the negative actually has some pretty strong ground, particularly on a utilitarian sort of basis. I think there are stronger arguments than I thought there would be. And so what I'm going to do is I'm going to run through just sort of thematically different types of arguments that the negative can advance. First, we're going to talk about the idea that public health may not be all that's cracked up to be. It may not be as great an approach as some folks might think. Secondly, we'll talk about how criminal justice has a role to play in the process. Maybe the status quo is not perfect. Maybe criminal justice is not ideal in its current form, but it has a role to play. And then beyond that, we'll talk a little bit about how you can stake out some negative ground by saying if you agree that it's a case-by-case analysis, you should vote negative. Talk a little bit about a hardcore libertarian argument which says it shouldn't be either. It shouldn't be criminal justice or public health. And then finally, talk a little bit about responding to plans. So let's get started with the idea that maybe public health is not as strong an approach as some people might think. And I think the critical concept to make this argument work in your case is going to be the idea that if you vote AF, you are voting for the public health system that actually exists, not a hypothetical, perfect public health system that might exist one day. In other words, the phrase is you go to war with the army you have, not the army you wish you had, right? The debate theory conception of this would be, Judge, look, the resolution says we're going to treat it as X or treat it as Y. That's the only choice you have in your fiat power, right? Your fiat power being your ability to make the resolution come true. You can move us from a criminal justice conception into the public health conception, but it has to be the actual public health system that exists today. If the resolution said we should put our money in the stock market, not the bank, right? That's fine, but realize that if you affirm that, you're going to be putting the money in the stock market that exists, not a hypothetical perfect stock market. And the same thing is true here. You're going to be putting your focus into the public health system that it actually exists. And in many parts of the world, the public health system is very poorly funded. In some places, it's essentially non-existent. You know, we're going to link to some studies and some data that talks about how public health in many parts of the world is, you know, I don't want to say a joke, but it is not a high policy priority. And so you cannot, as the affirmative, come in here and assume we're talking about developed first world countries, wealthy countries, countries that frankly do even more than the U.S. does. Because if you look at rural areas of the U.S., public health in many parts of this country is very poor. I actually thought that this was phrased really well by one of the writers. The Victory Briefs put out some briefs occasionally. I'm not going to quote it extensively because I know they have to make their money by selling them. But there was one really good quote from a guy named Marshall Thompson. And he said basically, look, you know, in some societies, to say that we're going to treat something as a matter of public health means that the government is effectively going to ignore it entirely. And, you know, Marshall, I don't know you, but I absolutely agree with that. You know, and he's making the point that what public health means in some countries and what criminal justice means. He also points out that criminal justice in many countries can be a very compassionate system that has public health built into it. So it really depends, right? But in many places, public health is very poorly funded, and we're going to have some sources on that. Even here in the United States, you can find sources that talk about how our existing public health system is, quote, woefully underfunded under the current administration. So remember, you're throwing this not into the perfect public health system that you might envision. You're throwing it into the one that the Trump administration is actually funding, with an underfunded Centers for Disease Control, CDC, and underfunded programs in other places, right? The other thing I would point out when we talk about why public health maybe isn't the greatest approach is that the empirical record of public health is far from ideal, right? And the example I gave earlier at the very beginning of the video was the idea of comparing opioids, like prescription opioids that are not, you know, illegal. It's illegal to use them without a prescription, but they are not per se illegal, right? They're not a felony to possess them. Comparing those to heroin. And, what we actually see when we look at the data is over the last, decade and a half or so, the number of people dying as a result of heroin is actually considerably lower. And it was very low for a long time in comparison to prescription opioid users. And it's still a little bit lower today. Even most recently, as the two have kind of gotten closer together, it's still 17,000 for prescription opioids versus 15,400 for heroin. And the argument would be that we clearly have treated opioids, things that you can go and get prescribed from your doctor, mainly as a matter of public health, right? Yes, you do occasionally arrest a doctor, and yes, you do occasionally arrest people who are stealing them and selling them, but for the most part, it's very rare to hear of someone who gets Vicodin and uses it being arrested and thrown in jail, whereas heroin users routinely are treated as a matter of criminal justice. So one is much more focused on criminal justice, one is much more focused on public health, and the one where public health has been the focus, not over the counter, but prescription opioids like Vicodin and things like that. That's been the one where more people have died. Right. Another example would be, for example, look at Norway. Norway has had very liberal drug laws for a long time, has had a public health approach, generally speaking, to its drug laws for a long time. They recently decriminalized all recreational drug use, although that's probably too recent to factor into statistics, but their rate of drug fatalities is the 6th highest rate in the world, according to some rankings. So clearly this idea of a public health approach does not magically result in saving more lives. The second thing I would talk about when we look at public health would be that there are other options that are even better than public health. In other words, if we agree, hypothetically, that criminal justice isn't the right paradigm, that doesn't necessarily mean that public health is the only other option. And if I, as the negative, can show you a third option, like an even better approach to drug use, then you should negate the resolution. So, for example, we might say that even if we reject criminal justice, we ought to follow something like what's called a learning model of drug use. And this comes from Dr. Mark Lewis. And his basic point is that most drug use is actually volitional and it's a conscious choice, and that the user does have some agency to decide what to do, even if they are addicted, right? And so to just treat drug use as a disease, like cancer or like some other disease that you contract, like HIV, you can't control what it does to you, right, is both incorrect and counterproductive. It assumes a lack of agency and it assumes a lack of ability to control yourself. And most importantly, he would say, it doesn't equip the person to make better choices going forward in their life. And so under this learning model, we would reject, right, the judgmentalism and the condemnation of the criminal justice approach, just like public health would do that. But we would not view drug use as a brain disease or a disease that you can't control. We would view it as a failure of understanding that would require the person to take responsibility and to learn and to develop the skills to overcome the problem. And he would argue this is different from a medical approach that treats drug use as a disease, which is essentially what public health is, that this is a third way and that it is even better than the public health approach. So that's another way to come at the issue of the public health side of things. Now, when we flip over to the criminal justice side of the house, basically the obligation saying we've got to get rid of criminal justice. The argument is simple. The negative wants to say that the criminal justice system has at least some role to play, right? And I think one concept the neg is really going to want to win is the idea that the phrase "not of criminal justice" in the resolution is a very clear, specific mandate that means that for the AF to win, the criminalization of drug use must end, period. Not we reduce its intensity, not we make criminal justice less prominent, not we reduce its role. Not means not, right, so to speak. And so you as the neg are going to want to insist that the affirmative has to get rid of criminal justice entirely. And you're going to say that that's basically bad, right? You're going to say that criminal justice should still play a role even if it's modified. In other words, we should do both public health and criminal justice, but not either or, right? And one really interesting point on this is that, as I mentioned earlier, some of the real experts like Alan Leshner, who will probably be cited by a lot of affirmatives for the idea of, for example, addiction being a brain disease, mitigating culpability. Even Leshner says, as I mentioned earlier, that the criminal justice system, as you can see here, has a role to play, that it has a role to play in getting people in the door, compelling them to participate in these rehabilitation processes. And so that's a potential problem for the AF and a potential advantage for the negative. And one simple argument, articles in multiple places will say that, we do both. We do criminal justice and public health in part by using the criminal justice system to require people to come in the door and go to the rehabilitation programs and participate in the rehabilitation programs, because otherwise they're not going to want to. And if the state can't exercise some degree of compulsion of forcing people to do it, which is often done through the criminal justice system, even for low-level misdemeanor type stuff like drug courts, right? Just we're going to bring you in here and put you in the criminal justice system and charge you with a misdemeanor, and to avoid a longer sentence, you're going to go and do rehabilitation, right? That argument would be that we're going to use it as a means to enforce the need for you to engage in rehabilitation. Another interesting argument, this comes from Calkin in 2014, it was actually summarized in Vox, is that keeping criminalization of drugs is a good idea even if you lower the punishment level to basically zero and you lower the enforcement level to zero. And what Calkin argues is that by having drugs be criminalized, even if we almost never enforce it, we drive the price way up. Like, we drive the price of different illegal drugs up by over 100 times. And that makes it a lot harder for people to get them. And it drives down the number of instances in which people can sort of casually try them or casually obtain them. And it means you're going to see a lot less drug abuse. Calkins says that while he doesn't like the status quo any more than anyone else, he thinks that if we were to simply remove the criminalization of drug use, it would make it so cheap to get these drugs, right, that many, many more people would try them. And so his argument is, look, don't get rid of criminalization, just make it really minimum. Make it more like an inconvenience. Make it a misdemeanor like a traffic ticket, like some very, very low level criminal offense, but keep it criminal so that the police can come and seize the drugs, they can interdict the drugs, they can take them away, but basically lower the penalties and the enforcement as low as you possibly can. And what that'll do is it will make it hard to actually obtain the drugs. It'll make it more expensive to obtain the drugs, but you won't, be ruining people's lives, as we've seen in other cases. And, the last point you can make under this, I think, would be the idea that many criminal justice systems around the world already incorporate public health and do it very effectively. So, for example, you might look to a place like the Netherlands, which is a country that has generally very progressive drug laws, generally treats the matter as a public health matter, has lots of interventions available to help people who are addicted to drugs, but also still keeps a formal criminalization of drugs, right? It is still formally illegal to use drugs. Now, it's almost never enforced, right? It is almost never enforced, but the reason they keep the criminal prohibition on drug use is to allow them to regulate it. They can designate certain places and shops where you can legally use drugs, and then they can keep it a criminal offense in other places. Even if they almost never enforce it, they still keep it on the books as a matter of criminal law. They treat it as a matter of criminal law, even if nobody or very, very, very few people ever actually go to jail. And this argument is that it makes the supply, the illicit supply, the supply floating out around in the world, it keeps it low, it keeps it more expensive, and it also allows the government to have the leverage to regulate a few places where you can legally use it, right? And so this strategy of keeping it criminal but dramatically lowering the level of enforcement is something that's actually done in the real world, and it's just a means of maintaining leverage. And so this might be an argument about how you can incorporate criminal justice in a way that's different than the status quo, not harmful, but not get rid of it entirely, which should be negative territory. A related point would be, I think very closely related, the idea that the negative wins if you're conducting a case-by-case analysis. Right? The argument would be, based on the wording of the resolution that we've talked about many times already, that the AF basically has to advocate for a sort of a categorical public health approach. And the idea would be, if you look at different countries like, for example, the Netherlands, and you say, you know what, that approach works pretty well. Our approach might be different, but that approach isn't bad. There's no reason to abandon it. It's clearly pretty effective, right? Then what you're doing is admitting that we should do this on a case-by-case basis. We don't need a blanket rule of public health, not criminal justice. We can allow different countries to find different solutions. If you believe that different drugs perhaps merit different responses, or if you believe that different levels of criminal enforcement might matter, right? If you agree that we should look at it it on a case-by-case basis, that would be negative territory. I'm not going to spend a whole lot of time on this because I think, frankly, it's kind of implicit in some of the stuff we've talked about before, but this is certainly a tactic that you can use. Now, briefly, because this was mentioned to me by some other folks, there is always the hardcore libertarian argument. The idea that the negative can run that it's none of the government's business if I use drugs at all, right? It's certainly not a matter of criminal justice. However, it's also not a matter of public health because, public health is necessarily somewhat coercive. It can involve compelling people to be involved in rehabilitation. It can involve taking resources away from society and using it to try to correct people's behavior. And because it can be coercive in many cases, trying to alter a person's behavior, a true hardcore libertarian would say it's a matter of personal choice. And as long as I'm not hurting anybody, right? As long as I'm not going out and committing an independent crime or an independent tort or a legal violation, if I'm just using it, and that's all we're talking about in this case under this resolution is just using it, it's really none of your business. And look, if you want to stake out a principled argument like that, first of all, I really respect that. As a judge, I love to hear people who come in and don't try to hedge their bets and don't get all mealy-mouthed and just say, nope, here's a philosophical principle. I'm going to really know it and understand it and take a stand on it. I think it's not a bad argument at all. It's just you are under the harm principle under Mill. As long as you're not hurting anybody and committing a separate crime, in which case prosecute that crime, it's none of your business what I'm doing. The state has absolutely no business criminalizing this or forcing me into some sort of public health model. Last thing I want to talk about in the negative is just very briefly, we've been talking about the validity of using plans on this case. I'm not going to go over the arguments about that. What I am going to do briefly is I'm just going to put up on the screen a sort of, I guess you'd call it a shell. It's just sort of a general argument that I have used with debaters in the past when we have had a similar language in a topic about why the language of the resolution doesn't allow for a plan. Part of the purpose of this channel is to kind of be an open source resource. If you think this would work for you, you can read it right there. You can pause the video and screen cap it, or you can write it down. The card is the actual card that we used earlier in the video, the Downing and Locke card, so that would be what you would be using there. But if you'd like to give it a try, feel free. I mean, don't cite us because we're not like a source, we're just advisors. But feel free to use it on this resolution or to adapt it to others. It was written for a tournament in which we expected a lot of theory about plans to be hit back with on this. So if you're in a league where you might not, you might adapt it. But this is just the thought on how to address the plan argument. Feel free to use it or not. Overall, though, I think neg has a lot of good ground, a lot of different options. Just remember, the main thing is that as the neg, you're saying, look, the AF has to do more than show you that the status quo is bad. Agreeing that the status quo is bad is just like getting on the bus. But you have to do more than get on the bus. You have to agree that the AF is going to take you to a very particular stop on the bus, a stop where we do public health and not any criminal justice at all. And if you disagree with either of those, if you think criminal justice has any role to play, or if you think that there are any better options for public health, or that public health is not so great, then at that point it's a negative ballot. So a real balanced resolution, and I think we're going to have a lot of fun with it. Now let's do some quick final thoughts. So very briefly, the video's gone on long enough because it's a complex topic. I will say I like it a lot. There are going to be some great tournaments. It's going to be really competitive. So I wish everybody the best of luck on this. If you have questions, drop them in the comments below. We'll do our best to respond to them. We've got a busy early March as well, so it might take us a couple of days. But again, you're going to find all of the sources we cite below in the notes, all the timestamps in the notes. Follow us on Twitter if you're interested. And remember, as always, debate is supposed to be fun, and we want it to be an enjoyable experience for you. So have fun, work hard, and hail state.